Hi, I'm Scott Godfrey. I'm a Principal Lecturer in Marketing Recruitment in the School of Health and Life Sciences here at Teesside University. And my colleague Anne French, who's the Associate Dean for Marketing Recruitment in the School of Life Sciences, are going to go over some of the frequently asked questions that we get from applicants, and also some of the questions we get at some of our open days and our Discover Health days, to help you navigate through some of the questions you might have about the school or your course or your application process. So Anne, often when we do open days and we go out to colleges, we get asked common questions, or what we call frequently asked questions. Quite often we get a lot of questions around courses and the differences between our courses. So in particular, when we go out, we get questions about our nursing courses, and quite often students or applicants don't understand what fields of nursing are available and what the differences are.
Yeah, that's a really good question, Scott. So we've got a very big provision for nursing here at Teesside, and there are 4 different fields of nursing that you could go into. So first of all, adult, and I think a lot of people know what an adult nurse does. We get a lot of applications for adult nursing, child nursing, and then mental health, and also learning disabilities. So sometimes people have got to think about what career they want to go in before they actually come to Teesside. So, it's really helpful if they have a little look about and think about what area of nursing they might like to go into, because it is one programme. Now, the first year is all taught together, and then after the first year, then they more or less branch off into the different fields. But the good thing about the course is you do get a little bit of a taster of what it's like to be in an alternate field. And that's because the Nursing and Midwifery Council want nurses to come out at the end of the 3 years to be able to look after patients with mental health issues, learning disability issues, with children or adult nursing, depending on what field of nursing they go into. So there's always an opportunity for 2 weeks to have an opportunity to go in to look at an alternate field. But the placements of where people can go on is a big variety, really. So you can work in an acute hospital, you can work in the community, in primary care, the independent sector, hospice. There's a variety of areas that people can go in, but just understanding what area of nursing that you want to go into at the beginning of the course is really important.
Yeah, how would you advise applicants to kind of look into that? What's the best way to look at the different fields and the differences between the fields? Because quite often the questions we get is, should I come and do adult nursing, or what people call general nursing, and then I'll specialise later. So I think it's almost a safe option to do general nursing. But what's the best way they can prepare to look at the different fields? And can you just do general nursing and then top up?
Yeah, that's a really good question. It is asked quite a lot. So I think the best way to prepare is really to have a look at the information out there, to look at our website, to look at our course information, to come along to an open day, because at open day we have staff available from different fields, and often there are students available as well who can give potential applicants a little bit more information about what the course entails and what career opportunities are available. So have a little look about, having a read about what does a learning disabilities nurse do. And there are also some national websites, so there's a lot around learning disabilities, mental health, child nursing, or paediatric nursing as it's known, and adult nursing. So have a little look beforehand, come along to an open day, write some questions down so that you can actually ask those really important questions to clarify. And they're really some of the most important things to do. But then you can't do a general qualification and then top up. You used to be able to do that, but it's not a recognised route now.
It doesn't mean you can't specialise in other areas, but there's not a designated course you can just top up.
No, there isn't. But you're right, you can specialise in a variety of different areas. And now, if you were qualified as a mental health nurse, if you're qualified as a learning disabilities nurse, there are lots of those types of roles within general nursing. So, for example, there's a lot of people who come into sort of an acute hospital with a learning disability. And there are lots of areas that have learning disabilities nurses working in a general hospital environment to be able to specifically support people with learning disabilities. So there's a variety of different career opportunities available, really.
And I suppose just one of the other questions that we get asked in terms of nursing, I suppose some of the other courses as well, but in particular nursing, is do I get to choose my placements?
So that is a really important question, and so people come with a particular area that they would like to work in. So for example, they might want to work in gynecology or palliative care, end-of-life care, and they're wondering whether they're going to have that specific experience during the course. If you can imagine, there's a whole variety of areas that people can actually work in. So it isn't possible for everybody to have every experience. Over the 3-year course, we introduce you to a variety of experiences, and the experiences that the NMC say that you have to have to actually qualify as a nurse. And then once you've done that, then you have the opportunity to move into different areas. But there are opportunities throughout the 3 years where you have what we call preferred option placements. So it doesn't mean that you can pick absolutely everywhere that you want to go, because there's a lot of students. And it would be impossible to give everybody their first choice. But we give you the opportunity to pick a variety of different areas. So for example, we say you can have 6 choices of a general area that you're interested in. For example, it might be about cardiovascular care, so if you're interested in looking after patients who've got heart problems, if you're interested in infection prevention and control, if you're interested in palliative or end-of-life care, there could be options. And what we say is if you pick 6 options, we're going to guarantee that you're going to get one of them. But it's not a specific ward or a specific department, it's an area of care that you were going to be allocated to.
Fab. And obviously, again, one of the things we try to convey when we go out and we chat to applicants is that there's actually lots of different careers in the NHS and the private sector and the voluntary sector. But lots of our courses lead to professional registration, so you can register with a professional body. One of those courses where you can register with HCPC is our operating department practice course. I suppose what we often find is sometimes applicants haven't looked around at what different careers are available, because there's actually hundreds of careers available in the NHS and lots of growing careers, and I think operating department practice is one of those careers that some people might not have heard about, or they might be unclear what they do in practice, but we're seeing lots more people applying for that course now. So if someone hasn't heard of an ODP or an operating department practitioner, what is it and what can they expect and what can they do in the NHS once they qualify?
That's a really good question. And an operating department practitioner, or ODP, is something like it's a very an area that people know really little about, and yet it's a really important area and a valued member of the multi-professional team. So if you think about a surgical experience, if you're going into theatre, you could work as an ODP in a variety of areas within that. So for example, they might work in pre-operative care. So when they're helping support the anaesthetist within the anaesthetic area, so that might be preparing a patient for theatre, and that might be preparing drugs, preparing equipment, but being in that pre-operative role where they're actually in the anaesthetic room with the anaesthetist.
So before the operation?
Yeah,
pre-operative.
So pre-operative, before the operation, absolutely. And then safely transferring the patient into theatre for surgery, so peri-operatively, that's known as.
So that's during the operation? During
the operation, absolutely. So supporting with equipment, maintaining a sterile field, supporting the surgeon, and that sort of whatever happens when a person is actually in theatre, they have a really pivotal role as part of the multi-professional team within that. And then transferring a patient into recovery, so post-operatively, monitoring the patient's vital observations, making sure they remain hydrated, making sure they're recovering from the anaesthetic safely, before then safely transferring the patient back to the ward after they've had their surgery.
So with something like ODP, if someone was to come along to Teesside University to study to be an operating department practitioner, how do we prepare them clinically before they go into this clinical setting?
Yeah, we've got really excellent facilities here at Teesside. within the school. So we have an actually simulated theatre. So we have an area where they can practice what it's like in terms of being in an anaesthetic room, so about intubation and what you would expect within giving somebody an anaesthetic. Moving into an area which is simulating a scrub room, so they get used to putting a gown on, scrubbing, putting the gloves on, and into the actual theatre. So we totally simulate what it's like to be in an operating theatre, and also into recovery. So everything that they would experience in practice, we've got the facilities to actually simulate that.
Yeah, so and again, sometimes we get people who think they want to work in theatres and think, well, should I be a nurse or should I be an ODP? That's quite a tricky question, isn't it? How would you advise an applicant who's stuck between general nursing because they want to go into theatres, or an ODP who might work in a theatre setting?
Yeah, I mean, that is really difficult, because sometimes nurses do want to go and work in theatre, and I think often it's because they don't understand the role of an ODP. So I think if theatre is an area where you really want to work in, and that's your passion, and you can't visualise yourself working in any other area, then becoming an expert in as an ODP is a really, really good career, really, because that's where you'll be. During the course, you might have the opportunity to go out and see people, patients in different areas, for example in intensive care, and understand about people's pain control. So you would develop those skills that are needed to assess patients within that pre and post-operative experience, really.
Fab. And obviously, I know we've got lots of new courses that are newly approved and that we've got applicants applying for now. And one of those is our dental hygiene course. I suppose, again, we get a lot of questions about what is dental hygiene, what can I expect, and how do I prepare to be a dental hygienist on the course at Teesside? So again, how would you advise applicants?
Yeah, so we have, again, we've just talked about the ODP facilities that we've got, but we have a student dental facility here within the school, which is an excellent facility. So GPs can refer patients into the student dental facility. So in year 2 of the dental hygiene course, you get the opportunity to practice those skills actually on live patients under the supervision of a clinician. But in that first year, we have a phantom head lab, which I know sounds a bit strange, but it's actually a head facility that obviously simulates what it would be like laying in a dentist chair, and the angle that you see a patient's head at. And we give students a mock set of teeth that's their own for 3 years to practice on. So they get the opportunity to use the equipment, what they would do as a dental hygienist in terms of scaling somebody's teeth, the equipment that they use, everything. They get to simulate all that on a phantom head before they move into practicing those hygiene skills on actually live patients in a dental facility.
Yeah, and the good thing about that lab as well is if you come along to an open day, you can have a look around the lab, and we often have students in there to chat to as well, don't we?
Absolutely, and the dental students are really keen and very enthusiastic, and a really good source of telling applicants around their experience and what to expect within that.
Yeah, I think it's also, we have cameras, don't we, in the dental lab as well. So when the tutor's also demonstrating a particular skill, students can visualise that on a monitor in front of them as well, so they can replicate what's being done as well. So
absolutely, yeah. So so the facilities in terms of the dental provision are really very good, and are definitely worth a look for at an open day.
And in terms of progression, how you know, because some applicants ask us about the therapy side of things.
Yes.
Is there a progressive route so that I can go down a therapy side as well?
Absolutely. So we've just had approved a Masters in Dental Therapy, and that's a new course. And previously we've had a dental and hygiene and therapy combined course. But it was felt that actually, in terms of developing as a therapist, it would be really good to provide a postgraduate qualification. So the idea is when you complete the dental hygiene course that you would go off and work as a dental hygienist.
Get those skills
and get
first.
those skills, that consolidation for a year, and then have that support by your wherever you work to actually progress onto being a therapist. And we found that that's a really good way, because you would be supported in practice. There's a lot of distance learning, but also a lot of on-the-job learning as well, to develop those skills as a therapist.
And again, when we're talking about new courses, that's one that's just been newly approved. We've had several, and one of those is our chiropractic course. And again, when I'm going out to colleges, and some of our colleagues are going out to colleges to do talks about health professions and the different roles you can go into, obviously with it being a new course and new to our area, many people haven't heard of chiropractors, or they might have heard the term but they really don't know what that role is and what the job is. And again, we get asked questions in particular around what the difference is between a chiropractor or a physiotherapist, for example. So what can you tell us about the chiropractic course, and how does it differ from that of a physio course?
Absolutely. So, as these new courses become developed, it's about raising the profile and in terms of for applicants, understanding which one to pick. And that can be really tricky, thinking about, do I want to be a chiropractor? What does that mean? Or a physiotherapist? Or even sort of working in sports therapy and rehabilitation. What's the difference between all of those?
Yeah, because there can be a bit of overlap between the three.
Yes, there can, absolutely. So if you want to be a chiropractor is a big focus on the musculoskeletal system.
That's their specialism, isn't it?
It is, that's their specialism. So they're looking at the musculoskeletal system, and often they work in private practice. And they specialise in that system and help patients with if they've had injury or particular if they've got symptoms and pain and with manipulation around that musculoskeletal system.
Chronic muscular and
absolutely.
Issues like arthritis and things like that.
Yeah, absolutely. Whereas a physiotherapist is different, and where a chiropractor often the focus might be in private practice. Physiotherapists can also work in private practice, and many do, but also they might work in acute hospital trusts, they might work in GP practices, they might work in community hospitals, they might see patients in their own home, and a variety of different departments, but they don't only specialise in the musculoskeletal system, but they do a variety of different systems.
Yeah, that's important, isn't it? Because again, when we get asked around, certainly applicants applying for physiotherapy, how do I best prepare? It's making sure you understand what the role of a physiotherapist is, because that is the one of the main differences. It's not just musculoskeletal, is it?
No, it isn't. It isn't, and it's around so respiratory care. So it might be around care of the lungs. It might be about cardiovascular care. It might be the neurological system, and throughout the course, students will have an opportunity to work in a variety of different areas. So sometimes people come along and say, I want to be a physio, and see themselves working with a football team or something. But during that programme, there's a lot of work within the acute hospital looking at the respiratory system, cardiovascular system.
Yeah, and again, physios will work in places like stroke rehab, won't they?
Absolutely, yeah.
ITU departments for chest clearances and stuff like that. So
Absolutely.
it's very diverse, isn't it?
Very, very diverse role.
So recently we've had a redesign and a makeup, I'm guessing, of our occupational therapy facilities at Teesside University, and we've seen lots of imagery around the new facilities. If I'm applying for occupational therapy, what can I expect from the course, and what can I expect from the facilities here at Teesside? Yeah,
you're right. We've had a lot of investment in the OT facilities, which has been really good, because I think around OT, it's another role that people are not always quite sure about what people do, but it's around maximising people's potential, and that might be within their physical potential. So it might be recovery from an injury, it might be living with a long-term health condition, it might be helping them to live with something like chronic fatigue or a mental health illness. And it's around being able to promote positive outcomes for people.
I think that's one of the tricky things about OT and occupational therapy as a role, is it because it's so diverse and because you can work with all age groups and in lots of different settings, it then makes it quite hard to define, doesn't it?
Yes, it does. Yeah, so you're right. So you can have OTs that work in paediatric care, elderly care, mental health settings, with people with learning disabilities. Often hospices have their own occupational therapist because they're helping people working within the limits of their live within the limits of their illness. And the facilities that we have simulate that. So we have a fully functional kitchen. So you might think, well, why would you need a kitchen? But it's, again, helping people to live within, being able to be independent, so being able to cook with themselves, maybe help them with aids and adaptations to help them do that. So they might need things to help them being able to carry a pan. So if somebody's got rheumatoid arthritis, which means they've got limited function in their limbs, how do they live independently with that?
So it could be simple tasks, even like turning on a tap, or
Absolutely.
what is seen as a simple everyday task to you and I, which is a bit more difficult if you've got an acute injury or condition or a long-term condition that affects your grasp, for example.
Yes, yeah, those simple things. Getting out of bed in the morning, some things that we do every day that we take for granted. For some people living with long-term conditions or recovering from a health issue, they are not taken for granted things. They're things that make it really difficult, and sometimes it makes people difficult to live independently.
So there's other areas apart from the kitchen, isn't there?
Absolutely. So there's a bedroom. So there's a bed, so to help people get in and out of bed. There's a living area. Again, so thinking about what might impact on people's ability to live in a living area. And then there's a bespoke teaching area as well. And then on the other side of that facility, there's a simulated ward area. So again, hospital bed area, moving and handling equipment is also present. So again, whether you are, working and helping people within their own home or doing that transition, often when people are in an acute hospital, and the ability to go home will depend on something like a home visit. So again, it's simulating those different areas that you might come into contact with patients.
So I'm aware we focus there on physical adaptations.
Absolutely,
but
yeah.
Occupational therapists are not just concerned with physical adaptations. They are also involved in kind of, as I said earlier, helping people with mental health conditions, work in children's areas, paediatric areas. They can work in schools and work with people with learning disabilities. So it's quite diverse, isn't it?
It is very, very, very diverse. And they help with a lot of different things like visualization techniques, management of anxiety. We've mentioned fatigue. So it is a really, really interesting and varied role. And like you said, working across, many different age groups.
And again, when we're going out and when we give our updates on different types of health careers and promoting different careers, one of those careers that we're seeing that's becoming more and more popular each year is diagnostic radiography. What is a diagnostic radiographer? Because that's a question I get often asked. What do they do in their role? And how do we prepare them to go into clinical practice again?
So a diagnostic radiographer is, again, when we've talked about all our health courses, we say that they're a pivotal role, but they are, and we've got multi-professional courses that all depend on each other. And being a diagnostic radiographer is using state-of-the-art equipment and imagery to help people diagnose either injury or particular health conditions. So for example, as a diagnostic radiographer, you might be warranted to take x-rays, for example, of somebody who comes into accident emergency. So somebody who's had a fall, who's been in a car accident, and they might need some images to look at what exactly is the extent of somebody's injury. Now, it's not only an x-ray, it might be a CT scan, it might be a more detailed, something called an MRI scan, it might be an ultrasound scan. So there are a variety of different forms of imagery that a diagnostic radiographer may need to operate. Now, some of those might be extended roles and require further study. So, for example, particular things around ultrasound scanning is a different qualification, but they all add up to helping diagnose conditions, and they could be, work in a variety of different areas. So we mentioned accident emergency, but they might be required in theatre. So when somebody's having an operation, maybe something like a hip replacement, might be required to take an x-ray while the patient's on the operating table to make sure that the new hip is in the right position. They might need to take an x-ray of somebody's chest. And again, there might be in an outpatient department where you and I might be referred by our GP to go and have something like a chest x-ray, or they actually might have to be on a ward where the patient is too unwell to go down to another department, so a mobile x-ray unit needs to go onto a ward to take a picture to be able to help aid doctors in terms of the diagnosis and the right form of treatment.
Again, one of the courses that is always popular up and down the country, in particular at Teesside University, is our paramedic course. And when you go out to colleges, when you chat to applicants and people come along to open days, they have a predefined idea of what a paramedic is. Now, sometimes some of that's accurate, sometimes it's very wrong. What is the role of a paramedic now, and what does our course offer people who come to study at Teesside?
Yeah, I think sometimes the idea of what a paramedic is all centred around sort of that responding to road traffic collisions, blue light emergencies, and often that's sort of supported by things that people see within the media or on television and
of course
documentaries.
It is a part of the role.
Absolutely, it is a part of the role, absolutely. But there are other parts of the role which might be around people ringing 999, requiring an ambulance if somebody's had a fall, going to pick somebody up who's fallen at home, or is deteriorating in a care home environment. So there could be a variety of different areas really involving a paramedic, but I think it's just to be clear that it's not always around that blue light emergency.
Because obviously there's a big shift as well to care in the community.
Absolutely.
And paramedics taking on a bigger role within the community and within primary care. So you see people who are paramedics who have gone on to roles maybe is a bit more advanced in the future in their career, to work in a GP surgery, to work in out-of-hours care, who are able to see, treat and discharge patients as well. So the role is expanding, isn't it?
Absolutely, it really is expanding. So it isn't unusual to see a paramedic working in a GP practice prescribing for patients. So it is a very, very different and varied role.
And again, one of the things we try to get across with applicants who are applying for paramedic studies is that it's not for everyone, because people have this idea of what they see on TV, or they might see an ambulance driving down the road with the blue lights on and think it's really exciting. But actually, you've got to have certain qualities. So what type of qualities would we look for in someone applying for paramedic studies? Yeah,
I think that's a really good question, because I think people do see that, and you see an ambulance racing down the road. And I always think when I see an ambulance going down the road, my stomach always does a little bit of a flip, because you know at the end of that, somebody is in some extreme situation, really. So it is really important to think about what qualities that you want and what skills, really. And I think there needs to be an element of resilience, physical resilience, because you can be on the go all the time. Mental resilience, because you have to deal with, you get up on a morning and go to work as a paramedic, and you're not really sure what's going to unfold, during that day. Could be a variety of different things, and some of it might be something that is really distressing. It might involve somebody being, who's got up for work that morning, being involved in a road traffic collision. So it might be something like that. It might be somebody who's collapsed, and you might end up resuscitating somebody, trying to resuscitate somebody. So it's that adaptability to that, not quite knowing what your day is going to be. And that can be very, very challenging and distressing sometimes.
Yeah, so We do help prepare students to go into clinical practice, so we don't expect them to be able to have this resilience, this physical and mental resilience, but we also have clinical skills labs as well to prepare people before they go into those situations, whether that be an emergency situation or a primary care situation. And again, we have a paramedic lab, don't we?
We do. We have a really excellent paramedic lab with 2 ambulances in. Students who are on our paramedic course get the opportunity to practice those skills actually within the confines of a real life ambulance, because it's different, you know, spreading out all over the floor when you're practicing a skill to actually being in the confines of being in the back of an ambulance. So I think that that's a really important thing, that you get to simulate that and feel what that's like. But you're right, we support people on the course in a variety of different ways, not only in terms of the development of the skills, but actually with that resilience. We're not expecting people to turn up on day one and be totally resilient. You know, there will be things that will be challenging within that 3-year programme, and we have, you know, systems in terms of personal tutors and assessors, mentors in practice that help support the student, you know, during that 3-year journey.
Fab. And I suppose that leads us on to another really popular course, and a course that people think they understand the profession, they understand the role, and that's that of midwifery. So we all think we know what a midwife does, and we've all heard of midwives, and you see TV programmes like Call a Midwife and things like that, and we maybe just get an image of a midwife which isn't really current. What is the role of a midwife and now? And how do we prepare people to go into clinical practice, into what is an ever-changing and advancing role?
Absolutely, and it is incredibly popular to be a midwife. And you're right, they watch things on television like Call a Midwife, and they think that they've got an idea of what it is. There are other things that maybe offer a bit more of a realistic description of the role, like One Born Every Minute, where you get cameras actually in a labour ward, and of course they see, you know, really lovely things, a baby's being born, and obviously that's the role. The role of a midwife is to help support women and empower women to have a pregnancy, and to think about how they are supported, and it might be around health professional and health promotional advice during pregnancy. But they also have got to support people when things actually don't go to plan, when things, as everybody says, you know, having a baby is a natural thing, but there are a lot of things that can actually not go to plan.
Yeah, complications.
Absolutely, complications, and they need to be able to support, you know, women during that time. And we have some excellent simulation equipment and labs within the university that help support students.
SimBaby.
We've got SimMum and SimBaby, absolutely. So you can actually simulate what it is like between, you know, within a labour ward and mum giving birth. But again, as we've discussed quite a lot, it's about being part of a multi-professional team, and that's really important. Really important that at the end of the course that students can come out and being able to advocate for mum, and to be able to make sure that they work together in a team. So excellent communication skills is really important to work as part of a multi-professional team.
Fab. And we haven't mentioned every course today. We've mentioned some of the courses. We have a whole range which can all be found on the website. And one of the things with all of our courses, because you get to do your degree or your qualification, and at the end of that, most of our courses you have to register with a professional body. We have certain standards in terms of what we're looking for. And finally, Anne, just a quick thank you for sitting here today and answering all the questions in terms of our courses.
It's fine, thank you.